the first part of the meeting. But I did want to get the agenda started. We have guests here today, and I want to be mindful of everybody's time. Our first item on the agenda, we have RJ Konkolevsky. He's from Helping Heroes, which goes with us here in the Northern Panhandle. We're very familiar with the work that they do here in the community on behalf of veterans everywhere. I know that I've had a privilege working with them for the past couple of years. So they are here today to brief the committee on their activities and what they have going on here in Panhandle. You guys want to, we'll present that down there.
Yeah.
If you guys, as you present, if you would just give everybody your name and who you're with and your title, just so everybody is familiar, and the floor is yours.
Yep. Senator. Swear.
And also we'll take an oath as we do for all testimony given before the committees. If you will raise your right hands, you swear to affirm that the testimony you're about to give will be the truth, the whole truth, nothing but the truth.
I swear.
Okay, thank you. Floor is yours.
Good afternoon. My name is Jeremy Harrison. I am the founder of Helping Heroes. RJ was asked to come up and talk about the organization, and he thought it'd be a decent idea to drag me along. So I jumped on the opportunity. I'm also the founder of the Northern Panhandle Veterans Council, which I'll touch on in a minute too. We're doing a lot of work with other legislators in the government. In fact, we had a meeting a couple of weeks ago with many of the legislators from the Northern Panhandle, talking about some of the issues that we see that need to be addressed. But at any rate, so Helping Heroes, who are we? I'm going to talk to you for about 5 minutes, and that's essentially no time for me. I'm very long-winded, but so Helping Heroes was started back in 2013. I used to work for the VA, and I was a counselor for combat veterans, and realized that there was a need for a certain category of veterans that wasn't in existence at that time. So my wife and I, we bought some property in Moundsville. We rehabbed it completely and started providing assistance to veterans in need. Now, who are the veterans in need? So we work with primarily the homeless veteran population and the near homeless veteran population. When I was seeing the veterans individually, mostly I was working with the veterans from Iraq, Afghanistan, and surrounding areas. I learned that a lot of veterans coming back were either too sick or too wounded, or had sustained other injuries, or had other illnesses that kept them from going back to work or being able to find a job. Many families were broken up because of the wars that happened. So what we were finding was that a lot of veterans were struggling financially. No employment, getting divorced, which we know costs money, all sorts of different issues that cause the problem of homelessness or near homelessness. And I just, I got tired of veterans coming in all the time talking about, I can't pay my bills. I'm sleeping on my friend's couch. My wife and I aren't getting along. I got fired from my job because, essentially because of their PTSD related symptoms. And so they really had nowhere to go. I mean, there was some space up in Pittsburgh that they might have been able to go to, but around here, there was nothing in existence. So we decided to take that on, and we've had pretty good success. So RJ is going to talk about what the organization does specifically, the types of programs that we have, but know that we've provided some sort of service to over 1,000 veteran families. And when we talk about veteran families, we're also talking about spouses, and we're also talking about children. It's one of the things that people don't really think about often when they're thinking about these veterans that you're trying to provide services for. There are many children involved in these families. They're homeless families, or families living in vehicles, or wherever they can, and there are children involved. So I think it's important to point that out. So we started in Moundsville, and then we moved to Wheeling back in 2020. We have a temporary office right now at office space in the McClure Hotel while our new building is being built. And again, I'll let RJ give you the exciting news about our building. So having said that, I will turn it over to him. And then I'll jump back into the end and talk a little bit about what the Northern Panhandle Veterans Council is working on.
Thank you, Jeremy. RJ.
Thank you. My name is RJ Konkoleski. I'm the CEO at Helping Heroes. I've been there just around 4 years now. And if you've been following any of the news in Wheeling, everyone is searching for a solution to the homelessness problem. And I'm sure that's not unique to Wheeling, probably all over the state of West Virginia, probably all over the nation. But I will tell you that there is no homelessness problem. Homelessness is a symptom of just the things Jeremy was mentioning. It's a symptom of unemployment. It's a symptom of mental health. It's a symptom of addiction. You can't look at homelessness as the problem. You cannot eradicate homelessness. You have to meet people where they are, find out the causes, and try to mitigate the causes. And wouldn't it be great if we could meet these veterans before they're living in a tent or before they're staying under a bridge, and have interventions happen earlier to avoid them becoming homelessness? That is how you would solve the homelessness problem. Last year, we served 56 unique veterans in the 5 counties, the Northern Panhandle, at our organization. And as Jeremy mentioned, there are family members, spouses, partners, children involved. When you add all those together, it was over 300 individuals that are affected by homelessness or near homelessness. So it is definitely a big issue and a big problem, for the whole area, and most specifically for our veterans, because they face a lot of these issues. So what does Helping Heroes do to help? Well, we do have prevention if someone's getting evicted. We can catch them up on their rent. We talk to the landlords. We can do rental assistance for a period of time to help them pay their rent and keep their housing. So that would be step one. For the literally homeless, we can shelter our veterans in a emergency shelter that we have funded through ESG, through the state. And while they're in that shelter, we're looking to get them into some of our other housing assistance programs. But our shelter is a little different in that, as I mentioned, we meet veterans where they are. There are shelters in the area that you can't stay at the shelter if you don't have a driver's license. If you're living in a tent or under a bridge, there's a good chance you don't know where your driver's license is or you don't have it. There are shelters that won't let you stay in the shelter if you can't pass a breathalyzer test. There are lots of reasons organizations have come up with to not shelter individuals, and our veterans, a lot of those conditions exist specifically in the veteran population. So we try to reach through that. In fact, when we meet the veterans we serve, the first thing we see isn't even a veteran. It's a human being, because that's who's there first. And that's the first step in getting assistance to them. In addition, we have 10 transitional housing beds. Veterans can stay up to 24 months. They don't pay any rent. They don't pay for their meals. They are there at no cost to them. And during that time, we have terrific case managers that are helping them increase their VA benefits, helping them find employment, which many of them do, and ultimately getting them to move out into the community, into their own housing. And we have a very high success rate with that program. it's amazing how, with that partnership of the case manager, our veterans, can secure employment, can have steady income. And then, seeing them move into their own place, it's very powerful. Out of all the veterans we serve in a year, we have about a 72% success rate. That's very high, given the volatility of the homeless population and the individuals we serve. So we have a great organization. We have a lot of great people working to help our veterans who are in need in the area. And of course, we appreciate the opportunity to come here today and tell you about it. And we appreciate your support through various programs and funding that the state offers, as well as the VA, to allow us to do what we do. Thank you.
Great.
Yeah.
So, as I said, I'm also with the Northern Panhandle Veterans Council, and in a way, it's kind of an arm of Helping Heroes for obvious reasons. But it's a really good group of veterans that several years ago, we decided that we were going to start tackling some issues at the state level, federal level, local level for veterans, something that we don't have the time or capability to do specifically with Helping Heroes. So we have veterans that, they come and go from the council, but we have a pretty good core of about 10 to 12 individuals who were very involved in all of our actions. We usually pick a couple things at a time that we want to focus on, just so we can put our time and energy into those two things and not have to give a little bit here and a little bit there and a little bit there. We can accomplish something if we all put our minds to just a couple of things. So our first big project was putting together a resource guide. So there's a really nice resource guide for the Northern Panhandle of West Virginia out there. I don't have any with me today. We're actually in the process of getting more because we're almost out of them. But it has a lot of local and national resources. Really, any veteran can benefit from that book. So that took us quite a while to put that together. But our other issue, one that we've been tackling for several years, is the suicide problem. So, as you know, suicide is a real problem with our veterans that are returning from combat situations. And we worked with one legislator or a couple legislators a couple of years ago, Senator Ryan Weld included, about getting a program at the state level so that we can have more individuals that are working with those veterans, or being available for access to services that we don't necessarily have other than at the VA itself. And as we all know, it's not always that easy for veterans to get to those places or get in touch with someone that they need to get in touch with. So it is a process. As I said, we had a meeting a couple of weeks ago, and we had some legislators that said they're going to Helping Heroes specifically to get a crisis manager on site there. So I'm really looking forward to that. One of the things I did to get their attention when we talked about suicide, if you're from the Northern Panhandle, or maybe you've heard of these little townships outside of, if you're from outside of Northern Panhandle, but I asked the question, I said, these are the populations of these small communities. 100 West Virginia has 257 people, Pine Grove 353, Beach Bottom 540, Triadelphia 667, and it goes on. There's 11 communities that I picked out, and I could have picked out a bunch more. But which one of those communities would you be willing to eliminate? That the suicide rate in West Virginia for veterans is higher than the population of each one of those communities. So make a choice. Which community you want to get rid of? And that makes it real. They're real individuals that have real issues that are affecting a lot of people. And so, moving forward, we'd like to try and accomplish some things so that we can address this issue appropriately and accordingly. I know there was some legislation last year, and this was one of the other things that we talked about. And then I'll wrap it up. But we talked about the veterans hunting and fishing license and the fact that there were a multitude of individuals who tried to put forth different types of legislation pertaining to veterans and getting their hunting and fishing license. And the reality is that right now, as it stands, if they're 100%, they can get their hunting and fishing license, and that's great. Lots of states just give veterans their hunting and fishing license without any questions asked. But I know it's a difficult process to go from just veterans 100% all the way down to veterans that aren't service connected. But there's study after study after study that states that veterans that have been through combat or other type of trauma benefit from outdoor activity. Fishing and hunting are the two, right off the bat that come to mind. Trapping, I mean, there's a whole bunch of different things that they can do. But I mean, the National Institute of Health even mentioned that veterans that have access to outdoor activity should their symptoms deteriorate, or I should say their symptoms improve, I'm sorry, after a while. So it's something that really needs to be considered. I know each one of those was kicked out by the finance committee. It didn't get to go through, but I think it's something small that we can do for our veterans. If you want, if they're service connected, maybe they can get a license or something like that. But again, I'm with the Northern Panhandle. This is what we do. These are some of the issues that we're tackling. And so, having said that, I'm going to finish and hopefully some of this resonates with you. But keep Helping Heroes in mind. We do a lot of fundraising as well. We're having our 11th annual A Night to Remember event in May. So if you get an opportunity to support that or come to that, it'd be great. Thank you. You have anything else you want to add? Thanks.
Jeremy, RJ, thank you so much for being here. I have a question before.
Yeah.
If anybody has any questions. How is progress on the building?
Progress on the building is good. We've got the roof has been completely repaired. We've done our asbestos abatement. We are working with Kathy Colby at the West Virginia Housing Development Fund on some funding options for the building. And we had to do a more in-depth phase 1 environmental study, which we just got completed. So we're kind of working through that process, which is why right now you won't see a lot of construction going on. But the plans are laid out. We will have 15 non-congregate apartments in that building for veterans in that transitional housing program. And we will have 2 floors of offices in that building. As Jeremy mentioned, he and Susan started this organization, and now we've got 10 employees. And when that building opens, we'll probably have many more. So we are providing a lot of resources, but we're also making an economic impact on the Northern Panhandle by employing individuals, employing veterans that we serve. But we plan to be in the building by October. There are certain times of the year that the VA likes to do inspections of our transitional apartments. So we kind of need to align our move in with their timeline. So.
Other questions, Brian? Senator.
Thank you both of you all for being here today. You're doing such a good job. Do you have any plans for moving into other parts of the state after you succeed up here?
They counter me.
Well, we talk about it all the time. We certainly do.
Come to the southeast.
And there are some other similar programs, but as far as the transitional housing, we are unique in West Virginia to that. So I think, we're in the middle of a major project here with this. It's a $7 million building project in downtown Wheeling. I think once that's settled down and we get it operating smoothly, it might be time to look for where else could we offer these services.
Very good. Thank you.
Thank you. Other questions?
Lastly, I'll say this just for consideration. veterans in West Virginia that are receiving service-connected compensation and from being injured in some way in the military are currently bringing in over $2 billion to the state right now. So a veteran that wasn't contributing at all is now contributing up to billions of dollars to our state. That's just everyday spending. And so that's something else to consider when you're thinking about how we can support our veteran community. I know a lot of things come down to money. Without those veterans, it's a lot of money we wouldn't have.
Gentlemen, thank you both for being here and thank you for what you do, the veterans of the Northern Panhandle. I look forward to working with you guys in the future. Appreciate you guys being here.
Thank you for inviting us.
Thanks.
I'm going to look to my co-chair here today, Delegate from Mercer County. We now have established a forum, so to him for motion on the. Thank you, Mr. Chairman. Move the approval of the minutes from September 11th and October 16th interim meetings. The delegate from Mercer County used that the minutes of the previous meeting be approved. Any discussion? If not, all in favor say aye. Aye. Opposed? That's good. You guys do have it. Motion is adopted. Minutes are approved. Our next and last item on the agenda is Secretary Ted Diaz from Veterans Assistance. Secretary, it's good to see you. Thanks for being here today. Welcome to the Northern Panhandle.
Thank you, sir.
If you can raise your right hand and swear that the testimony you're about to give will be the truth, the whole truth, nothing but the truth.
I do.
Thank you, and the floor is yours.
Pardon me. A little stiff. So if I could just clarify just a little bit or make one comment. The work that Helping Heroes does here in the Northern Panhandle, I mean, it's indispensable. And I'm so proud to have them part of our veteran community. So, gentlemen, thank you. Thank you so much. With that, I'd like to go into our suicide prevention. According to the Federal Department of Veterans Affairs data, the suicide rate for veterans nationally has fallen from a high of 22 suicide deaths per day to nearly 17 per day in 2020. Based on the 2022 National Veteran Suicide Prevention Annual Report, which was released last September 22. The 2023 edition hasn't been released yet, but as soon as it does, I'll be more than happy to report on that. Although this is an improvement, I think we can all agree 17 is still way too many. What these numbers don't show is what the global COVID-19 pandemic, the resultant, the economic shutdowns, the exceptionally high levels of inflation that followed has done to our veteran community, particularly those veterans and veterans families that are on fixed incomes, such as military retirement and VA disability. The federal VA has not released data on the number of veteran suicides by state in several years now. However, we usually lose in this state between 40 and 60, sometimes more, to suicide each year. The VA has identified that rural veterans are at greater risk of suicidality than those in the urban and suburban areas. We are a highly rural state. I think it goes without saying. Veterans are nearly twice as likely as non-veterans in our state to die by suicide. This can be because they're further from the care that they need and support in these more isolated communities. I've spoken previously about the billions of dollars that the federal VA spends on mental health, which is which has been budgeted this year for $13.9 billion. These funds are spent in an attempt to prevent suicide crisis. The amount of funds that they spend to combat crisis of suicide has also increased to $497 million. I'd like to highlight one of those more recent changes. One of the challenges I mentioned the last time we met, I spoke about this subject before to this committee, was that more than half of the veterans within the state who died by suicide were not enrolled in the VA healthcare system, either because they weren't eligible, they felt as though they weren't eligible, or they just didn't enroll. So I would like to add that my department, one of our primary goals is to get veterans enrolled into the VA healthcare system. In 2020, Congress passed the Comprehensive Prevention, Access to Care and Treatment Act of 2020, also known as the Veterans Compact Act. This allows any veteran, whether they are enrolled in the VA healthcare system or not, to go to a VA healthcare system, VA hospital, or a non-VA emergency room for emergency suicidal care. Although passed in 2020, it wasn't fully implemented until this past year. There are some qualifiers, but generally, unless the veteran has received a discharge that would bar his benefits, such as dishonorable, they can seek emergency mental health care at any facility capable of providing emergency mental health care for up to 90 days per crisis event. It's not just a one-time for each crisis event. This is paid for by the VA. There's no requirement for them to enroll in the VA healthcare system to get this care. This is a huge thing for veterans. And we're here trying to get the word out and partnering with the federal VA to do so. We continue to be involved with the VA Substance Abuse and Mental Health Services Administration. I know it's a mouthful. We call it SAMHSA for short. And this is led by the Governor's and Mayor's Challenge to prevent suicide among service members, veterans, and the veterans' families. That body has been working with state governmental agencies across the country, stand up a veteran suicide mortality review team. And we're trying to do that. The group is trying to do that in this state. This would help provide state-specific data on suicide risks and the methods to which veterans have been committing suicide. We're also working on starting a suicide prevention program designed to work with various communities across the state and connect veterans with the resources they need to address the issues that could lead a veteran to a suicide crisis. This program was approved but was unfunded in 2021 legislative session. We have since received some funds through the budget process and are continuing to build out this new program. We believe that this program, once fully operational, will help connect veterans with the help that they need and the resources that already exist throughout the state through a community-based network approach. It will enhance the prevention, the intervention, as well as the postvention as it relates to suicide. Once we can demonstrate an operational and successful suicide prevention capability, we will be eligible to apply for VA grants to grow the program even further. With that, I yield for your questions.
Thank you very much. Other questions of our next secretary?
Thank you, Mr. Chairman. Thank you, Mr. Secretary. Do you mind, I was trying to take notes here, and I think I missed a couple parts. Would you mind repeating the part about any veteran can go to a veteran medical facility? I just want to get the detail.
Yes, the act itself is the Comprehensive Prevention, Access to Care and Treatment Act of,
No acronym?
what's that?
No acronym?
Compact. And do you need the House Resolution Bill number, the
No, I
HR
don't.
number?
Appreciate it. Thank you.
8247.
Thank you.
Now, that act, it allows the veterans, whether they're enrolled or not, to go to the VA for emergency crisis care. If there's not a VA hospital nearby, or they just want to go somewhere outside of the VA, they can be admitted, they can receive that emergency crisis care through any non-VA emergency room.
Thank you.
You're welcome.
Thank you. Further questions? Secretary Diaz, thank you so much for being here today. And
Thanks, Emma.
look forward to working with you as we head into the regular session.
Look forward to it, sir.
Further business? I'm up to Delegate Mercer for a moment.
Mr. Chairman, I move we adjourn.
Questions on adjournment? All in favor, say aye. Aye. Opposed? We're adjourned. Thank you, everyone.
Thank you.